Hey there, Ryan DeWitt from DeWitt Physical Therapy. I'm going to talk about how to use the RODO 2-in-1 mobility tool to loosen up your low back and your hip. So in physical therapy, we know that it's really common for anybody that has any back issues to have hip problems. Or if you got hip issues, you might have some associated back problems. Or when it comes to even things like athletic performance, we want to make sure that our hip can move away from our spine really well. So that being said, a lot of times we want to address both the hip and the spine. So what we're going to do is I'm going to show you a little sequence that we use in the PT clinic for the low back, the glute, the TFL, and even the hip flexor. So we'll kind of take this one at a time. I'm going to start by taking the RODO apart. I'm going to start off with just the single ball, and we're going to use this on our low back. So if I take a look at my low back here, here's the center, here's my pelvis. I want to find this corner that's right about here, and that's where that ball is going to go. So I'm going to lie down on my back. I'm going to take the ball, I'm going to place it in that little corner. Then lying on my back, I'm going to take that same side leg and bend it up. It's going to slack my hip flexor here. And then if I just rotate over just a little bit, that ball is going to kind of be pressing here, and I'm laying my spine and those low back muscles right on top of it. And I can just breathe here. So breathing in my belly is a good thing, and coming back out. So I can rock back and forth. I can even move this up a little bit if I need to, but sometimes it's even just nice to kind of hang out here. So I'd maybe do like a minute or so on each side. Next, we want to get into the glute. So we're going to use a single ball again, and I'm going to just kind of put myself up on top of it. And I'm going to do the same thing. I'm going to take that leg and cross it over, which is going to wind up that hip. And then I can just roll all through that glute. So I'm in control. I got one foot on the ground. I got two hands on the ground. And I'm just going to roll all through that glute. So what we want to be careful of is we don't want to put pressure on the bone here or the bone on the outside of the hip, but try to stay on the meat, if that makes sense. And so we'll just roll around, see what you can find. We got your piriformis, we got glute med, we got a whole bunch of stuff back there that have longer names than I care to repeat right now. Let's see if we can just find that spot. Even if that's okay, you can just kind of hang out there. Breathe into your belly if you need to. That's okay too. So that's kind of the outside of the hip. Working around to the front, we got this muscle called our TFL, which runs into our IT band. So the TFL and the glute are both going to pull on the IT band. So we want to see if we can loosen that up a little bit too. So again, we'll take that single ball, put it down. This one is going to be right where your pocket is. It's that's where it is. That muscle pokes up right there. So put that down here. Just going to put a little bit of pressure on it, and I can have it there. I can bend my knee and kind of rotate it in and out, or I can even roll onto the side just a little bit and then even take my leg and bend it up and straighten it out. It's almost like whatever works best. I just want to see if I can find that spot. This is the one I like the most, and just kind of rock it back and forth. So same thing, 30 seconds to a minute. And then last, again, we're working our way all the way around. We want to get to that hip flexor. So let's take this thing, put it together. Because of the little stay in the middle, it works pretty well to be compressed this way. So to get that hip flexor, we're going to think about aiming between our belly button and the point on the front of our pelvis. So right here, there should be a little soft spot. And then I'm going to come on down on the ground, kind of tack it in place. Try to keep this nice and vertical. Put a little pressure on it. I can still breathe, I can still talk. This isn't terrible, but I can feel it giving me some pressure. Then for that hip flexor, if it's really tight, it'll limit that hip extension. So all I'm gonna do is just kind of squeeze my butt and squeeze my quad and try to get a little bit of a hip extension moment there. If I need to, I can even bring that opposite leg forward a little bit and try again. And I can feel the difference between the two of those. And same thing, I should be able to just be here, breathe into my belly. As I breathe in, I might feel a little bit of extra pull, extra pressure. That's okay. None of this should be too painful. So if you're able to do that on both sides, you would really be able to loosen up the back side of the low back, outside of the hip, front of the hip, and really that deep hip flexor, that whole lumbo-pelvic hip complex. Give it a try.